This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what to do if your wound is infected. If you like this video, we put out new content weekly, so please like and subscribe. So in my last video, I talk about how to tell if a wound is infected. Basically, it gets red, starts draining fluid, it swells up, and then it hurts. So if you do have an infected wound, what can you do? Really, it depends where it is, and it depends how deep it is. If it's just on top of the skin, first off, you want to see a doctor and you want to have them to diagnose that, right? If you don't do anything about an infected wound, it'll just spread around. In the worst case scenarios, it keeps spreading, and then it can go into your bloodstream, and you have bacteria in your bloodstream, something called septic, and you can get very, very sick. So you don't want that to happen. So if you do have an infected wound, you got to see a doctor and they have to look at it, and if it is, they'll put you on antibiotics. So for most superficial infections, that'll take care of it. Obviously, you want to cover it up. But there's a problem. Sometimes antibiotics aren't enough. If you have a big pocket of pus, like underneath the skin where the wound is, then the antibiotics are not going to be able to get rid of that whole pocket of pus. So what ends up happening is someone has to do surgery on it and drain it. So basically, if you have a big infected area, the treatment is for surgically drain it, clean it out, leave the wound open. You don't want to close infected wounds because you need that wound to drain and all the bacteria and bad stuff to come out. If you close it up, then it'll trap all that in there. So if you do have a big pocket of pus, or an abscess we call it, you need to get it surgically drained, leave the wound open, and you'll be on antibiotics. And depending on how big the wound is, you might need something, some sort of dressing. And the simple dressings are like wet to dry dressings, or you put them on there wet, wait for them to dry, and peel it off, and that gets rid of kind of the dead material, all the way to something like wound vacuum, which is basically a high-tech device that just sucks on the wound continuously. Again, it needs to be put on by a professional. But if your wound is infected, that's basically what you need to do. At the least you need to do is get antibiotics and cover it up, and then possibly use topical antibiotics. And the most is you would need surgery, cleaned it out, and a whole bunch of wound care to get it to finally heal. So I hope I was able to answer your questions about what to do if you have an infected wound. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you medical advice about your specific condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.